Hi everyone, this is Bhavagnya and I'm here to tell about scissors. So let's see what are scissors. A seizure is a sudden uncontrolled burst of electrical activity in the brain that causes temporary abnormalities in muscle tone or movements, changes in behavior, changes in feelings and level of consciousness. The repeated seizures are termed as epilepsy. Stages of seizures. There are three stages of seizures: aura phase, ictal phase, and post-ictal phase. Aura phase. This phase starts right before a seizure and starts over 5 to 20 minutes. The symptoms include vision problem, nausea, dizziness, and feelings of intense fear. Ictal phase. This is a stage of seizure. During this, intense electrical changes happen in brain. The symptoms include loss of awareness, muscle tone, feeling confused, and trouble speaking. Postictal phase. It is the final stage where the brain tries to stop the nerve cells to stop the misfiring and allows the body to relax. It lasts for seconds to hours. The symptoms include drowsiness and confusion. Types of seizures. There are two types of seizures: generalized seizures and partial seizures. Generalized seizures, they involve both sides of brain on onset of seizure. As of partial seizures, they involve only in one part of brain. Generalized seizures is of two types: tonic-clonic seizure and absence seizures. Tonic-clonic seizures are also called as grand mal seizures, which involves loss of consciousness, stiffening of muscle, and jerking movements. Absence seizures, they cause loss of awareness. Partial seizures are also of two types: simple partial seizures and complex partial seizures. Simple partial seizures, they do not impair consciousness and cause twitching. Complex partial seizures, they affect consciousness and may cause repetitive movements. Here comes the etiology, which means the cause. It is caused by brain tumors, stroke, CNS infections, head injury, electrolyte disorders, idiopathic, brain tumor, drug and alcohol withdrawal, and hypoxia. Pathophysiology. Due to the etiological factors, the integrity of the neuronal cell membrane is altered, where the cell begins firing with increased frequency and amplitude when the intensity of the discharges reaches the threshold and the neuronal firing spreads to the adjacent neurons, resulting in a seizure. Now, let's see the clinical manifestations, which means the symptoms. They include temporary confusion, uncontrollable jerking movements of the arms and legs, fear, anxiety, loss of muscle tone, frothing, and impaired consciousness. Diagnosis. The seizures can be diagnosed by the history of the patient, physical examination, blood test, CT and MRI scan, lumbar puncture, EEG, and single photon emission computerized tomography. Treatment. Anti-epileptic drugs are the first-line treatment for seizures, which includes phenytoin, carbamazepine, valproic acid, lamotrigine, levetiracetam, and oxacarbazepine are commonly used. The newer AEDs include lacosamide, brivaracetam, and eslicarbazepine acetate are also used. These drugs should not be taken with oral contraceptives, opioids, antidepressants, and CNS depressants. Herbal supplements can reduce the effects of AEDs, and antibiotics like erythromycin should not be used with AEDs causes toxicity. The current surgical treatment for seizures is resective surgery. Preventive measures. Preventive measures in case of seizures are very important. They include: try to prevent a fall, cushion the person's head, have meat, cheese, and most fiber vegetables, have adequate rest and sleep. Avoid driving operating machines until seizures are controlled. Take medication on regular basis. Avoid alcohol. Call an ambulance if the seizure lasts for more than 5 minutes. Avoid caffeine and high sodium fruits and sugary foods. Emergency management, which should be followed in case of seizures. The patient should be placed in the side lying position. Seizures precautions should be maintained, like suction and oral airway. Do not put anything in their mouth. Move objects that cause an injury. Loosen any tightening clothes around their neck. Cushion the person's head. Do not restrain their movements. Note the start and end time of seizures. If it lasts for more than 5 minutes, call emergency services immediately. Thank you.